First tonight, official confirmation of what many of you suspected, that your negative PCR result may have been wrong. We first reported on this over a week ago when you began to get in touch with us to say that despite getting a positive result on a lateral flow device, your PCR had come back negative, even though you had classic coronavirus symptoms. Well, we spoke to the experts.
Myself and my colleagues have seen a sort of stream of patients with what we would consider very typical COVID symptoms.
Telling people to self-isolate, even if they get a negative PCR test, might not actually be that practical for many people.
Well, at that point, UK Health Security Agency, formerly known as Public Health England, told us that they were looking into things. We didn't let it go. Last Friday, Andrew pestered them and they told us that there was no problem identified with the lab. But that didn't stop you emailing. Yesterday, we spoke to Christine from Wiltshire. She works in a primary school. She was at a loss to explain why her PCR was negative and really worried about potentially spreading the virus to everyone at work, especially the children.
I thought, this isn't right. I don't feel right. I know I've got COVID. And then later that afternoon, I had the results back from my home test kit and it was positive.
So this morning, finally, just before 9 a.m, the UK HSA announced that an estimated 43,000 people, many from here in the southwest, may have been given an incorrect PCR result. Well, let's go straight to Andrew. Andrew, this is rather worrying for a lot of people, isn't it?
Hi Seb, yeah, over the past few weeks I've had people tell me they thought they were going mad, wondering if they were imagining their coronavirus symptoms, even some people saying they were accused of lying about having the virus. But now we know that they weren't mistaken. There was a lab and it was churning out dodgy PCR test results, and it was doing it for a really long time, from the 8th of September up to the 12th of October. So the question really is, when it seemed so obvious to so many people that there was some kind of problem in the testing system, why wasn't it picked up sooner? And what are the implications for all of those people who were told that they didn't have coronavirus, but they really did, who then went out there and carried on as normal?
The evidence has been overwhelming. Hundreds of stories sent in to us, all with one thing in common: positive lateral flow tests followed by a negative PCR. And after we repeatedly asked whether there was a problem within the testing system, now news that tens of thousands of PCRs processed at this lab in Wolverhampton have been falsely negative, meaning thousands of people were wrongly told they were virus-free.
By this point, I thought, I'm going mad now because I know I've got COVID. I know I've got it, but the results came back negative. And I contacted my GP, and my GP said, no, the PCR test is a gold standard test. You definitely haven't got COVID. And I couldn't believe it because I thought, I've got 2 positive cases in the house. I've got all the symptoms. This can't be right.
Over the course of the last week, I've had 5 PCR tests, and it was the same for lots of my parent friends locally, because this has hit my child's school quite badly. So there's a lot of us in the same boat, that we were just waiting to be told that we'd got a positive result, continually being told it was negative.
Many places in the West have had very low coronavirus rates lately. It could be that those wrong PCR results mean those rates were falsely low, and there was much more virus out there than anyone thought.
The numbers will look falsely low, although actually probably what's happening is we are starting to see rises in many of the places impacted. And that's partly a result of the fact that people have been going about their usual business, assuming that the PCR test is the gold standard and that they've tested negative so that they don't need to isolate. But actually, we're probably going to see big kick-ups in the numbers in the next few days.
After days of asking, we did manage to speak to the UK Health Security Agency today and asked them exactly when they realised things were going wrong.
So we think that there's potentially been a problem from the 8th of September through until the 12th of October, and that's the period of time that we're interested in and have been investigating so far. The actual problem was identified earlier on this week, and over the course of the last few days, there have been increasing amounts of investigations to look into actually what the cause was, where we think that that's taken place, and what it is that needs to be done.
The advice for those affected is that they will now be contacted about what to do next. But for many people who were told they definitely didn't have coronavirus, the damage has already been done. Andrew Plant, BBC Points West.